Hello students, today's topic is sulfonamides. What are sulfonamides? These are the drugs which the first most effective chemotherapeutic agent to be used systematically for the prevention and cure of bacterial infections in men. And these are bacteriostatic in nature and widely used for both gram-positive and gram-negative bacteria. And this has structural resemblance with the para-aminobenzoic acid, antagonize it competitively during the synthesis of folic acid in bacteria. And most effective sulfonamides which are used as a therapeutic agents are sulfonanilamide and para-aminobenzoic acid. So sulfanilamide is simplest sulfonamide as it contains sulfonamide group in first position of benzene ring as shown in para-amino group at fourth position is essential for its activity, and it can be replaced by such radicals as can be converted in the tissue to a free amino group. The derivatives of sulfonamides have replacement of hydrogen present in sulfonamide group present at first position of benzene ring, and these are highly potent compounds generally have substituent of heterocyclic aromatic nuclei at N1 position. And further we are going to discuss about the classification of sulfonamide. Depending upon the duration of action, these are short-acting sulfonamides, intermediate-acting sulfonamide, long-acting sulfonamide, and poorly absorbed sulfonamide. Short-acting sulfonamides, these are readily absorbed and given every 4 to 8 hours. And the drugs which comes under this category are sulfadiazine, sulfadimidine, and sulfapyridine, and sulfafurazole. And in under intermediate acting sulfonamide, these are readily absorbed and are given every 8 to 12 hours, and examples are sulfamethoxazole, cotrimoxazole. Long acting sulfonamides are given every 24 hours, and examples which comes under these categories sulfamethoxine, sulfamethoxypyridine, sulfadioxine. Poorly absorbed sulfonamides are given 24 hours, and the drugs which comes under this category is pethyl sulfathiazole, succinyl sulfathiazole. And further, for topical uses, sulfonamides are used topically in skin infections, and depending upon substitution at N1, sulfonamides are different types: derivative of pyrimidine, derivative of pyridine, and derivative of thiazole, derivatives of isoxazole, derivative of open chain radicals. And we are going to discuss about these examples also. A derivative of pyrimidine and the drugs which comes under this category is sulfadiazine, sulfamethazine, sulfasomidine, sulfadimidine, etc. And the derivatives of pyridines are sulfamethoxypyridazine, sulfaline. And thiazole derivatives are sulfathiazole, succinyl sulfathiazole. Isoxazole derivatives are sulfamethoxazole, sulfafurazole, and sulfamethizole. And now we are going to discuss about the drugs individually. And the first drug is sulfadiazine, and it is available in the market as a brand name Diazil, and its IUPAC name is N1 pyrimidine 2-yl sulfanilamide. And its properties are: it is white, yellowish white, or pinkish white crystalline powder. It is insoluble in water but dissolves in aqueous solution of alkali hydroxide and in dilute mineral acid. And it should be stored in light protected container as it slowly darkens on exposure from light, and it is used for rheumatic fever, meningococcal meningitis, cancroid, etc. Preparations are available in sulfadiazine BP, IP, sulfadiazine injection, sulfadiazine tablet, BP and IP. Next drug is sulfamethoxazole. It is also available in the market as a brand name Gantanol. IPAC name is N1 5-methyloxyl 2-yl sulfanilamide. Properties are: it is white, yellowish white crystalline powder. It has no odor with bitter taste. It is slightly soluble in water and soluble in aqueous solution of alkali hydroxide. It should be stored in tight light protected container similar as sulfadiazine, and it is used in urinary tract infection. Next drug is sulfamethoxypyridine, which is pyridine derivative, and brand name is Liderkin. IPAC name is N1 6-methoxypyrazine 3-yl sulfanilamide. Properties: white in color, yellowish white crystalline powder. It can also occur in this form. It has no odor with bitter taste, and it darkens on exposure of light. Insoluble in water but soluble in aqueous solution of alkali hydroxide. It is also to be stored in tight light protected container. Next drugs which comes under this category is cotrimoxazole, isoxazole derivative. Brand name is Septran, Bactrin, Ciplin, Sidal. Combination 5 parts of sulfamethoxazole and 1 part of trimethoprim. It produces bactericidal or bacteriostatic action against both gram positive and gram negative organism and some type of protozoas also. It is used in case of urinary tract infection, respiratory tract infections and GIT infections. Preparations are cotrimoxazole injection BP, cotrimoxazole dispersible tablets BP, pediatric cotrimoxazole and suspension BP. Next drug is sulfa dimethoxin. Brand name is Madribon. IPAC name is 2,6-dimethoxypyrimide 4-aryl sulfanilamide. Properties are it is white crystalline powders. Almost all the drugs which comes under the category of sulfanilamide have the same crystalline powder in nature and odorless, but some taste should be bitter. Might be bitter. It is slightly soluble in water. And almost all the drugs should be stored in tight, light protected container. And it is used in urinary tract infection, GI infection. Next drug is Thelile sulfathiazole. Brand name is Thelazole. IPAC name is 4,13-thiazole 2-aryl sulfamoyl thalanylic acid. Properties it is white or yellowish white crystalline powder. It has no odor and bitter taste. It is insoluble in water and it also get darkened on the exposure of light. It must be stored in airtight container as well. And it is used in case of GI infections, bacillary dysentery. It is also used in preoperative treatment of patient undergoing surgery of intestinal tract.